to us by one of our experts that the influence, no, the influencers, which influences the community or the individuals from having themselves vaccinated. For example, if these are healthcare workers, they are influenced into being vaccinated when the chief of hospital have themselves vaccinated, when their fellow co-workers have themselves vaccinated. So dun po sa tinignan po namin na datos, yun po mga local officials based on that study did not provide any influence during that time that healthcare workers are being prioritized. So ngayon po, hindi pa ho natin nauulit yung study based dito po sa mga surveys na to, dito naman po sa ating komunidad.
Siguro, Madam Chair, if we can enjoin the DOH to also do behavioral studies, yung mga qualitative, not just the quantitative. I think that's very important kasi syempre culture, diba, is so vital to the policies na gusto nating ma-adopt ng ating mga kababayan. Last question, Madam Chair. Earlier, during the hearing, there were slides presented by Secretary Charlie on the priority population groups. So yung A1 to A5 and then B1 to C, no? So I understand ito yung magiging guidelines for government as it undertakes the inoculation. But then I also know that the private sector will be able to procure on their end yung mga vaccine. And then I don't know if that donation policy still holds, no? But siguro my question is, how can we ensure that the private sector will be complying with this priority population guidelines?
Before DOH answers that, I think there's a rejoinder from the ILG USEC Rico Judge for the previous questions. You're now recognized, the ILG USEC. Kindly unmute, USEC Rico Judge.
Thank you very much, Mr. Chair. The DILG, pursuant to a memorandum circular, which I think the policy came also from DOH, is enjoining all LGUs to follow a strict guideline on how to encourage the population to be vaccinated. And not just to encourage them, but also to prepare the vaccine storage areas where the vaccines will be coming in. And at the same time, Madam Chair, this is also in coordination with DOH on how we could further enhance the communication plan. There's already a plan and there's already a memorandum circular issued by DILG for all LGs to follow, and we are now monitoring them on that, Madam Chair. Thank you.
Okay, Yusek Rosette, your reply to the last question of Kongtov.
Madam Chair, I'm sorry, I missed that. Ano po yung tanong? Kung maaari lang pong ulitin.
Okay, all right. So, may priority population groups guidelines kanina si Secretary Charlie na shinare sa atin. Yung mga A1 to A5 and B1 to C on the second slide. So, I know that the private sector will also be procuring on their end. And this was recently allowed by the President. So how can we ensure that they will be following these guidelines as well?
Madam Chair, if
okay,
I...
Yes, Yusek Rosette.
Salamat po. Honorable Congressman De Venecia, during the agreements with the private sector and with Secretary Galvez, our vaccine cluster, and Secretary Duque, one of the agreements would be that as soon as we have finished with our priority sectors A1 to A3, and then the private sector can then start their inoculations. Also, part of the discussions with the private sector, and they have recommended actually based on studies internationally that the simultaneous vaccinations have helped countries to speed up their inoculations to better protect their population. So now how do we police if they follow the prioritization? According to Secretary Galvez, as long as we have finished with the A1 to A3 and the A4 is already starting, they can already do their inoculations for the private sector. I guess also mentioning the tripartite agreement, which specifically provides that the private sector has to align with the efforts of government. So yun po, binigyan naman po sila ng ganong instruction ni Sec Charlie matapos lang yung A1 to A3 and then their A4 can already be started.
Sorry, quick follow-up, Madam Chair. When is the expected timeline of completion for A1 to A3?
Yes, Yusek Rosette.
Based on the slides, Madam Chair and Honorable Congressman of Sec Charlie, this afternoon when he presented, there was this timeline where he said that by May, simultaneous vaccinations from A1 to A4 would have already started. So it means that we are not targeting that we will be able to finish the A1 to A3 sector by April or May because we know it depends on the supplies. But he said that by May, based on his slides, that simultaneous vaccinations, including the A4 sector, will already start, and private sector will be part of that rollout.
So the private sector also has a role in the A1 to A3.
Madam Chair, if I may.
Yes, Yusek Rosette.
Yes po. For their healthcare workers, meron din po sila. May senior citizens na rin po silang naisasama natin. Meron na rin po silang with comorbidities na pwede nang isama. At saka they also provide us assistance when it comes to the other logistical requirements and other demand generation activities for this vaccination program.
And then how do we aggregate all of this data? Because there's inoculation through the private sector, through government, national government, and then you also have inoculation through the local government units. So how do we know if Juan de la Cruz or Juana de la Cruz have all been inoculated? Is there like one database that's constantly updated?
Madam Chair?
Yes, Yusek Rosette.
Yes, Madam Chair, there is a common platform which Yusek Mirna has mentioned a while ago. I can refer the question now to Yusek Mirna to give further elaboration on this.
Okay, a rejoinder from Yusek Mirna.
Yes, Madam Chair, this is what I referred to as the BIMS-BAS. This is the Vaccine Information Management System, Vaccine Administration, which is being spearheaded by the DICT together with the DOH, the DILG, and even with the PNP. Yes, sir, we will be able to capture the different vaccinations in the different areas. It will be blended initially, as I mentioned, it will be digitized for those who are more advanced, but for the less advanced areas, then they will try to catch up with the mga Excel, mga Google Sheet muna, but this can be uploaded to the digitized form that is being implemented and overseen by the DICT, Your Honor.
All right, thank you, Madam Chair. No further questions.
Thank you, Chair Toff. I see the hand of DS Eric Martinez. Yeah, you have the floor, DS.
Thank you, Madam Chair. Thank you, Madam Chair. Good evening to everyone. I just would like to ask this question with regards to the scheduling of the inoculation for those who will have their second dose. Secretary Galvez earlier on reported AstraZeneca would be arriving by May. And by the time we hit April, all AstraZeneca vaccines have already been given out. So given the schedule of the second dose, 12 weeks, and the arrival of AstraZeneca by May, I think, do we have a schedule for the second dose, or the strategy would just be we fire away for everyone for the first dose, then we'll just wait and see for others to take their second dose? Mind you, AstraZeneca, there are already 400,000 inoculated. So what would be the scheduling? And I just would like to be enlightened, Madam Chair.
Yes, Yusek Mirna.
Madam Chair, for the Sinovac, it's 1 month, 28 to 32 days interval. That's why there are already those who started first week of March are already doing their second dose. For the Sinovac, we had reserved the second dose. So of the 600, 300 lang po ang inoculate natin. But for the AstraZeneca from COVAX, actually that was expiring May 31. And given that the benefits outweigh the risk, and with the blessing of the WHO, we decided to give the all the 525,000 as first doses, contingent on the fact that we will have another batch from the COVAX sometime May or June. The interval for the AstraZeneca, sir, is 6 to 12 weeks. And there are studies which show that the longer the interval between the first and the second dose, the better the immune response. So we are confident that the vaccine for the second dose for AstraZeneca will come in May and later part of April and part of May. And we will be able to give the second dose, Your Honor. We are expecting actually a bigger number of 900,000 doses. So that will cover our 500,000 initial first doses, and we will have some extra for the 400,000. But for this next dose that will be coming, we will ensure that there will be a reserved second dose already for the AstraZeneca. Thank you.
So we are assured of
Yeah.
that. Okay. Yes, Eric.
Kasi Madam Chair, it's really important yung scheduling, napapag-usapan yung A1, A2, A3, A4. We have to factor in the second dose of this vaccines, AstraZeneca and Sinovac. If we could only get more of the J&J, the Johnson & Johnson single dose, what do we have there? Bakit? I think it would be more comfortable for everyone kung yung J&J mas marami tayong makuha. Ano bang scheduling ng vaccine na yun? Single dose lang yun.
Yusek Mirna?
They have not yet been producing. They're still doing the clinical trials as far as I know. It has not even submitted an emergency use authorization, but our vaccine SAR is doing negotiation of how, if it will be able to take some J&J vaccine sometime end of the year, but it will all depend on the supply that will be available worldwide. But I'm sure the Secretary Galvez will be able to share if ano na po ang nangyari sa kanyang mga negotiation later on. Thank you po.
Yeah, please, Madam Chair, I just would like that please explore that possibility of the J&J dose being a single dose. It's more comfortable for our constituents. And gusto ko lang po sabihin, siguro pinakamaganda talagang way para ma-inform yung mga tao. Alam naman nila yung vaccine na yan eh. Ang nanonood lang muna sila. If we could hit 1 million na nabakunahan, dadami na yan. Talagang, kasi alam niyo naman ng Pilipino, ang sasabihin, panoorin ko muna kung ano mangyayari sa kanya. E pag umabot na ng 1 milyon niyang nabakunahan, ay 1 milyon na wala namang nangyari. And they will fall in line. So I think we have to meet 1 million mark, maybe this early April, first week of April. So we could continue on. So yun lang, Madam Chair, I'm just very much concerned with the second dose scheduling, and hopefully we could get more of the Johnson & Johnson single dose vaccine. Thank you, Madam Chair.
Thank you, DS Eric. Let's hope for that. DS Sharon Garin, I saw your hand a while ago. You're now recognized. You have now the floor. DS Sharon.
Ma'am, I just wanted to comment kasi magabi na. It's because when Secretary, it's quite surprising for me that when Secretary Galvez presented the number of vaccines, included there actually the private donations, no? And then we're actually including in our program, in which the government is primarily responsible, what we are expecting from the private. Dapat kasi tayo yung gobyerno yung nag-a-address ng problema. And in fact, we even impose conditions on the private and how these private donors will use their own vaccines. Parang deprivation of property na yan under the Constitution, di ba? Undue deprivation of property kasi we make them donate and we even tell them, ganito yung gagawin mo. I mean, as long as there are guidelines, but I understand it, right? They cannot do whatever unless the government finishes with their own prioritization. I'm not sure if I understand it right. Kasi parang unfair naman yan. Everything we do for the lowest of the economic, di ba? Tinutulungan natin the poorest of the poor and all those that are compromised and everything. But we keep on extracting donations and everything from the private sector. But we should also give them the proper respect. Kasi kaya sila gumagastos, donate sa gobyerno para makatulong at para naman makumpisa yung negosyo nila because it's dying. And di ko alam kung tama yung detalye ko, Yuseka. Pero it's just that I'll just continue with my comment, Mama. It's quite surprising for me actually that hindi tayo prepared sa vaccines. Naunahan tayo ng private sector. Aren't we excited to get the vaccines in the first place? We have an FDA that's not really very proactive in looking for cures or preventions of vaccines. We have contact tracing that is not working. It's just like it's been, I mean, I was patient 6 months ago, even 4 months ago. But it's a year already, 1 year anniversary na tayo. And we cannot be an OJT forever in this job. Many people are dying. And it is our responsibility. I'm in the legislative, pero I feel responsible because I cannot accept na this is the kind of country that I will leave to my son. Sana po, DOH, all the agencies, let's finish this pandemic and be proud of what we have done.
Okay.
Because right now I'm not really proud of it, and that includes the work of this executive part. So sana po let's be proactive and maawa naman tayo sa mga tao. We can only do as fast as we can on the laws and we have delivered, but it makes us feel like we need to intervene. Kaya very adamant yung mga congressmen today because they do see it in the grassroots and they feel it and they feel responsible. So sana po, let's work together naman and let's be more proactive kasi we have not done a good job this year. Thank you, Chair.
Thank you, Kong Sharon. Let's hear a comment from DOH. Yusek Rosette, you have the floor.
Thank you, Madam Chair, and good evening po, Honorable Congresswoman Sharon Garin. First po, ang private sector naman, hindi naman po sila pwedeng mauna. They have to go through the tripartite agreement. Now, why did government decide kung bakit po kailangan antayin nilang matapos muna yung vulnerable sector natin? Sana nga po nandito si Secretary Galvez to respond to this. But during the initial stages of negotiations, one of the primary objectives of government is not to create competition between government and the private sector. Dahil alam naman po natin that the private sector, they have the funds. So kapag nauna ho ang private sector na bumili, baka po mag-choke po ang national government and they cannot also procure at that level of funds that we have. Kasi pwede pong magpresyo ang private ng higher and then when government buys, yun po yung naging objective noon, that competition will not be there. Mauna lang ang ating vulnerables and then private sector can very well follow suit already and they can procure and do this inoculation among their employees. So yun lang po yung objective ng ating government. We take note of the comments of the Honorable Congresswoman Sharon Garin regarding the other factors in our response in government, like contact tracing and the others. We're trying as much as possible, very hard efforts already coming from all national government agencies just for us to stop the spread of this virus. Over to you, Madam Chair.
Okay, thank you, Yusek Rosette. Is there a follow-up question from Representative Sharon Garin? Is there any
I can't
another
unmute. Ayan.
question?
Mahirap mag-unmute sa meeting na to. may bantay. No, ma'am. It's just that, we asked too much from them, I think. We asked them to donate, and then we even put restrictions in there. Pero, it's no excuse. You're trying hard. Try harder, ma'am. It's no excuse that we are failing and we are performing worse than the rest of the region. We owe it to our people naman siguro. Trying hard, then let's try double or triple. And I see like a Department of Health who's not after the health of the country. FDA that is not, willing to give Food and Drug Administration to the COVID-related cases. It's just I don't understand it actually. Pero anyway, tama na. Alas 9
Okay.
na.
Okay.
Masama lang talaga loob ko. Pero anyway, thank you, ma'am. Thank you.
Okay, thank you. The next interpellator is Congressman Bong Suntay. Is he around? Congressman Bong Suntay, are you still around?
Yep, still here.
Okay, you have now the floor, Kong.
Now we have a total of 1,200,000.
Mute lang ako.
Paki-unmute.
Yeah. Yung clarification lang dun sa sinabi ni Yusek Rosette. Na-mention niya na there was restriction placed on the part of the private sector because ayaw ng national government na para magkaroon ng confidential purchasing ng vaccine between the private sector and the government sector. Did I understand it correctly na yun yung statement niya?
Yusek Rosette, can you please repeat what you said or some clarification on that matter, please?
Madam Chair, good evening po, Congressman Bong Suntay. Yes po, sir. That was one of the objectives why we had to do the prioritization framework and had to request from private sector that we finish first our first 3 sectors of our vulnerable before they can have their procurement for their vaccines. Although we all know that they have already pre-ordered and that they would start already by June 1. Ito lang po yung nirequest sa kanila ni Sec Galvez, i-prioritize muna at sumunod muna po sila doon sa prioritization framework natin.
Nagugulan lang ako. Was there ever a competition? We always ask for the private sector's help in everything. Kahit na nung mga panahon na kailangan natin nung mga pop-up na quarantine sites, hinihinga natin ng donasyon yung government sector. Nung panahon na bigayan ng pagkain at kulang yung binibili ng gobyerno, hinihinga natin yung private sector. Pero pagdating sa vaccine, yung i-vaccinate naman are people who the national government are considering to be vaccinated. In fact, kung ganun kabilis yung procurement ng national government, wala sanang problema. But as we see it, di ba, hindi rin as of now, iilan pa lang yung dumating na vaccine. And in fact, lahat ng vaccine came from donations and not from purchases of the national government. So yun yung hindi ko maintindihan. And now all of a sudden, when we realized na mabagal pala yung pagpasok ng vaccine at yung procurement natin, sasabihin natin, o sige, pwede na pala yung private sector, bumili na sila ng kanila. So ganun yung policy natin.
Yes, Rosette, can you please respond?
Yes, Madam Chair, from the outset, the private sector was not restricted to procure. It was just a request coming from national government that the prioritization framework be followed. That's why their procurement was scheduled in the middle of the year, because that was the estimate of national government that we can be able already to start inoculating our vulnerable sectors.
So as of now, ilan na yung na-inoculate ng government sector dun sa priority na dapat mauna? Have we finished inoculating all our frontliners or medical frontliners?
Madam Chair, may I
Yes,
refer
Yusek.
the question to Yusek Mirna, Madam Chair?
Yusek Mirna, you're recognized. Yusek Mirna, you're recognized. Kindly unmute.
Thank you, Madam Chair, Honorable Congressman. The jobs that we have done is already 700,000, and we have finished almost 50% of our priority listed A1. Ito po yung mga workers in frontline health services. Just to clarify, hindi po healthcare workers lang ito. These are the workers in frontline health services, kasama yung na-mention natin kanina, mga DSWD, yung mga living in closed setting, yung ating mga jail guards, yung ating mga nasa homes na taking care of the homes. Kasama ho yung mga utility, yung mga all those who are working in the facility, kasama ho lahat yan. So we have already finished 700,000 po.
Itong 700,000 na sinasabi natin na ito, ito yung first job o pati yung second job tapos na?
First job po, we are just
So, hindi pa
starting
tapos.
the second job because nag-start po tayo pang Suntay ng first week of March. And ang interval po ng Sinovac is 28 days. So nag-start pa lang po this week ang second dose ng Sinovac, Your Honor.
Now,
So, meron na
kagaya
tayo-
ng sinabi niyo, kagaya ng sinabi niyo, ito kasama pati yung mga jail guards, pati yung sinasabi mo kasama doon sa frontliners. It's not just medical frontliners. Pero isn't the economy as equally important? Kasi ngayon nakita naman natin, it's either you choose na you cannot choose one over the other eh. Kung hindi natin papayagan yung at hahayaan din ma-prioritize yung ibang mga gawa sa private sector, paano naman yung ekonomiya natin?
Madam Chair.
Kasi
Yes,
I would
Yusek.
understand yung mga health workers dahil yan yung yung medical health workers natin, yan yung yan yung front line. Kailangan natin sila, kailangan natin na protektado sila because they are the ones that help or give medical aid and assistance doon sa mga may sakit. Pero yung expanded list, kagaya ng mga jail guards, yung sinasabi mo, yung mga ibang BERT, yung sa mga barangay, inuna pa natin kaysa doon sa pribadong sektor, yung mga necessary components lang rin ng ating ekonomiya. So kailan natin sila papansinin?
Madam Chair.
Yes, Yusek Rosette.
Madam Chair, I'd just like to give the response, and then maybe Yusek Mirna can add to the inputs. But based on the framework that we have done, the prioritization framework, this is based on science and evidence. And the prioritization framework is based on the fact that these people who we have prioritized are more exposed, more vulnerable, and has that increased probability of dying from the disease. That's why we had healthcare workers and then senior citizens, those with comorbids. The essential workers are on the fourth of our priority. So ibig sabihin, they are also valued. Kaya lang, pag tinignan po natin in a scale, mas nagkakaroon po ng constant exposure ang ating healthcare workers, mas namamatay po ang senior citizens natin at mga may comorbidities. When in fact, the National Vaccine Deployment Program's objective is for us to reduce morbidities and mortality so that we can be able to manage our healthcare system. Kaya ganun po naging framework natin.
Yusek Virginie, sinasabi natin na it's based on science. In fact, lahat ng ginawa ng DOH was basically based on science. Yung ating attention dito, yung paglaban natin dito sa COVID pandemic is based on science. Pero ngayon, currently, among the active COVID-19 cases in Southeast Asia, number 1 ng Pilipinas with 124,680. So yun yung based on science natin. Doon sa response natin, we're number 1 in Asia, in Southeast Asia.
Yusek Rosette?
Yes, Madam Chair. Honorable Congressman Suntay, yun pong mga nangyayari po sa atin ngayon, katulad ng mga pagtaas ng kaso, although hindi naman po natin gina-justify, no? Dahil talaga namang pong tumataas ang kaso dito, pero pag tinignan po natin sa iba't ibang parte ng mundo, tumataas din po ang mga kaso nila. There are specific surges that are happening because of the...
No. I'm not talking about the surges in other country. Alam ko there are in fact increasing cases in other countries. I'm talking about Southeast Asia. Indonesia, which has a bigger population than the Philippines, has 22,326. We have 24,680. Malaysia only has 14,199. Myanmar only has 7,397. Thailand only has 1,348. So then there is, baka mali yung naging approach natin. Hindi kaya?
Kindly wrap up, Bong Suntay.
Yun lang,
Yusek,
Madam Chair, yung answer lang doon.
okay. Yusek Rosette?
Yes, Madam Chair. I think there are implementation issues and we are really cognizant of that fact. No? So katulad nga po kanina ng mga sinasabi ng mga czars, they were able to identify gaps, no, dito po sa mga pagpapatupad natin. Meron ho tayo mga angking weaknesses in our health system. Meron din po tayo mga kakulangan na kailangan din pa ho natin i-strengthen, especially for the local government's response. So these are all contributing. It's something that has to be done as a whole, kung saan national government, local government should be able to step up para po maiayos po natin. So these are implementation issues and we constantly review that and try to address these issues, Madam Chair.
Thank
Madam
you,
Chair,
Yusek.
uli na lang, Madam Chair.
Yes,
Very
Kong.
short lang. Because I just couldn't help relate this to yung naging issue natin dun sa ivermectin, because DOH was very quick to come up with a bulletin saying na hindi dapat gagamitin yung ivermectin because it is dangerous. Pero wala naman clinical trials pa na kinondak ang DOH, but they were not proactive enough to say kung makakatulong ba ito o hindi. Pero they were quick to say na wag gagamitin at hindi dapat gamitin. Yun lang. Parang when we say kasi that the reactions were all based on science, but after a year and looking at where we're at right now, then palagay ko yung scientific basis na ginamit nila parang puro mali.
Okay. Thank you, Kong Bong.
Thank you, ma'am.
Thank you. FDA and DOH will see to it that they will observe the timeline that we asked them a while ago. May we have the last interpellator, Congressman Kaloy Zarate of Bayan Muna. First question now, Kong Bong. Kaloy.
Dapat tayong mag-10 oras na tayo. Salamat, Chair. Sayang parang wala na si Secretary Duque at saka si Secretary Galvez. So, ang katanungan ko na lang, baka masagot naman din na Yusek Rosette. Yung una siguro, dapat malinaw, no? Dahil nitong nakaraan, sinasabi I think it was Secretary Galvez who said this, no, na yung donation ng private sector, ang nag-i-impose lang noon ay ang AstraZeneca, no? But they are not actually required. So, pwede pang malinawan ito dahil narinig ko na naman kanina na pag nag-inoculate na kasama ang private sector, they will be required doon sa kanilang binili na they will have to donate to the government. Ano ba talaga ang tamang nangyayari rito, Madam Chair? That's my first question.
Yes, Rosette. Can you please?
Yes, as far as I know, Madam Chair, good evening po, Congressman Zarate. As far as I know, AstraZeneca requires that the procurer or the private sector provide this assistance to national government. Maybe Yusek Mirna can elaborate on the other negotiations that are being done, Madam Chair.
Thank you, Yusek Rosette. Yusek Mirna.
Sa law po, inalis na yung 50% going to the national government. But this came, the initial talks were just a token from the private sector that they're willing to share their goods that they have procured to the national government. I am not party to the supply agreement, but yan po ang masasabi ko na they were not forced into donating the 50. Actually, it was a range, 20, 50, 80, but eventually they decided on 50 for the private sector. But after the first batch, I don't think it will be still the 50% to national government. So it will now depend on what will come out of the supply agreement between the DOH, the NTF, and the private sector. Pero hindi ho cast na in stone yung 50.
Thank
It
you,
was not
Yusek.
required of them. Thank you.
Thank you, Yusek Mirna.
Thank you, Chair. Thank
Kong
you.
Kaloy.
Yes, thank you, Chair. Thank you, Yusek Rosette. So, malinaw na ito ay tama. Wala na yun sa batas, no, na ipinasa ng Kongreso na mag-donate nga ang private sector. So, parang lumalabas, this is just a mandatory token as part of the ongoing negotiation. No? Hindi naman sila required under the law, but parang kailangan magbigay pa rin ng token at yun atang reklamo ng mga nasa private sector dahil as pointed out by the Honorable Garin kanina, this is actually principally the duty and obligation of the national government to inoculate our people. And ang mga pribadong sektor dahil nga hinaan nung rollout ay kailangan they have to intervene, no? Dahil gusto rin nilang bumalik yung ekonomiya, yung negosyo nila. And just to point out also the Madam Chair, no? Kanina kasi sinabi ni Yusek Rosette, no, na ayaw naman namin makikompetensya sa private sector because they have the funds. But Madam Chair, kung tutuusin natin, kung pondo at pondo rin ang kailangan ang usapin dito, mas malaki ang pondo ng pamahalaan, no? Kaya yun ang hindi natin maintindihan dito. No? Malaki ang pondo ng pamahalaan, malaki ang nilaan natin dito at in fact napakalaki ng inutang natin dito. No? But talagang gaya ng iba kong mga kasamahan, talagang nakukulangan tayo. No? Mahina yung rollout despite the fact that available funds, no? Although sabi nila nasa bangko lang yan, but still a question up to now, bakit kailangan sumama pa ang private sector, andyan pa ang LGUs natin. So, I don't know if Yusek Rosette or Yusek Mirna can comment on that, no? Pero yun po ang talagang sitwasyon natin ngayon, ano? Parang, in fact, we were abandoned by the national government. Yes, Yusek Mirna.
Yusek Rosette, you have the floor.
Thank you, Madam Chair. Honorable Zarate, actually, that's the main objective of national government to provide to all of the citizens of the country. And even Secretary Galvez mentioned this to the private sector and the local governments. Do not spend for vaccines anymore. You just spend for the additional logistical requirements so that we can have this kind of rational funding for vaccines. We can have some more assistance coming from you. But of course, we also understand the intent of the private sector because they would want to speed up vaccinating their employees so that they can open their businesses. So yun naman po ay pinayagan but through a tripartite agreement. But if we can have the choice, pwede naman pong bilan ng ang buong population natin na 70% to be inoculated by the national government.
Thank you, Yusek Rosette, Madam Chair. Tama po yun, ano? Kung tutusin talaga, pwedeng gawin ng national government. Pero you can also understand talaga the situation of the private sector. Nababagalan talaga sila, nahihinaan sila dahil while the other jurisdictions, other countries are already ramping up their vaccination, tayo po namimigay pa lang ngayon pa lang tayo namimigay ng libreng face mask, no? At gumagamit tayo ng meter stick para ma-observe yung social distancing, no? But may second point siguro, Madam Chair, no? Although wala na rito yung dalawang kalihim natin, nagkakaroon kasi ng confusion, no? Sa mga statements ni Pangulong Duterte, no? For example, yung nabanggit kanina ni Congressman Gaite about the indemnification fund, sabi niya, we will not allow that, no? We will not indemnify, no? Then the other day, ang sinabi naman po niya, the private sector can procure vaccine at will. No? It gives a false hope to the private sector na pwede na palang bumili. Diretso na bumili ang private sector, but that's contrary to the law on COVID-19 Vaccination Act of 2021 dahil nandyan ngayon tripartite. Yes. So, ito lang yung tanong ko siguro, no? I don't know again if it's in the Yusek Rosette or Yusek Merna is in the position to answer this. Sino ba talaga nagpapaliwanag kay Pangulo dito sa mga batas na pinapasa natin at nilalagdaan niya, no? Dahil every time merong statement na nilabas, kailangan pang i-explain uli, no? Paliwanag ng kanyang mga spokesperson dahil nagkakaroon ng iba't ibang interpretation ito, Madam Chair.
Yusek Mirna?
No comment, Your Honor. I'm not privy to the discussions.
How about Yusek Rosette?
We do not have, Madam Chair and Honorable Congressman Zarate, we apologize, but I think we do not have any authority to comment on this. Thank you.
Narito, no, siguro sa IATF din yan dahil kasi narinig ko kanina after that statement that they can procure at will, the other mga chambers of commerce, no, officials of the chambers of commerce are already say, okay, we will now procure the necessary. But at any rate, Madam Chair, ito na lang siguro ang tanong ko. We have already conducted inoculation. Ang hindi masyado napababalita, yung tungkol doon sa ano bang at this point, no, nasa ika-28th day or 29th day na tayo inoculation. Ano ba yung mga nadaanan na or na-experience na ng mga adverse effects, no, ng mga inoculated healthcare workers or the others, no, even elderly people, no, na at this point kasi previously yung sinabi itong Sinovac cannot be used doon sa senior citizens, no, and only AstraZeneca can be used to either health workers or senior citizens. Can you give us an update on this, Madam Chair?
Yusek Mirna?
Thank you, Madam Chair. In terms of the adverse events following immunization, we are monitoring that and it is being reported. The most common are yung increase in blood pressure, tapos yung soreness and swelling at the injection site. So, yun po ang namomonitor natin.
Ano po ang mga worst case at this point? Wala pa naman. Just like the other, sa ibang area, ibang jurisdictions kasi they reported blood clotting, etc. Wala po namang na-monitor pa rito.
Sa blood clotting, wala pa naman po na monitor, but we have a surveillance and response team that is monitoring ano yung mga common side effects. Of course, there was a mention of a coincidental death. If you heard the Muntinlupa case, yun po, it is really being investigated. All serious adverse events are supposed to be investigated and reported within 24 hours. There's a response and there's a team called the Regional Adverse Event Following Immunization Committee, a group of independent experts that looks at the causality assessment. After the regional, then it is raised to the National Adverse Event Following Immunization Committee that looks that further considers the causality that has been reviewed by the Regional Adverse Event Committee, Your Honor.
Thank you, Madam Chair. So, last question po na, Madam Chair, no?
Okay.
Finally, ito ano lang mga innocenting tanong lang ito as layman's question, no? Dahil iba-ibang mga vaccine kasi yung ating dumarating, ano? Nauna yung Sinovac, andyan yung AstraZeneca. For now, dalawa pa lang, no? Ang tanong ng marami, Madam Chair, pwede ba ang paghaluin yung dosage nito? Halimbawa, unang dose ko is Sinovac. Pwede bang dahil wala nang or nauna yung AstraZeneca, pero dahil kunti lang yung AstraZeneca, marami na ang Sinovac ngayon, may dumating na 1 million, kailangan ko na ng second dose, pwede ba yung Sinovac na ang administer doon sa ating mga healthcare workers, Madam Chair.
Okay. Yusek Mirna. Yeah.
Madam Chair, the general principle, wag paghaluin yung vaccine. And we ensure that may second dose siya. The reason we do na hindi pinaghahalo yung vaccine generally, because pag nag-adverse event po, hindi na natin alam kung kanino i-attribute yung adverse event sa anong bakuna. It's not only the DOH and the national government that is monitoring the adverse event. Even the drug companies po, part of their EUA is to monitor ano yung mga adverse events na nangyayari sa kanilang produkto. Maraming salamat po.
Thank you, Yusek Mirna. Thank you, Kong Kaloy Zarate. That wraps up our discussions on the vaccine program. We now go to the other matters. Kong Stella Kimbo.
Ay, thank you. Actually, Madam Chair, matagal kong pinag-isipan kung paano ko tatanungin itong question na to. But after 10 hours of listening to everyone, I felt like it's my duty to ask this. Actually, this has to do with the reporting methodology of DOH. Kung naalala po ninyo, a few days ago, ang reported new cases was 7,999. Okay, I can't remember kung anong petsa na yon, but I remember the number. It was 7,999. Anyway, my concern is that I actually knew that it was going to be 7,999 24 hours before it got reported. So nakakita po ako ng text na allegedly from someone from DOH saying that tomorrow the report is going to be 7,999. So medyo parang, of course, I did not mind it. Sabi ko, this is, it's a very weird text. So nagulat na lang po ako na the following day, indeed, the reported number of cases is 7,999. So as a private citizen, actually po, I was crushed. Kasi ako po, family ko, we anticipate, alam mo yun, with bated breath, yung report of new cases every day. So para sa akin po, sagrado yung number na yun. So nung na-realize ko na, teka muna, what's happening here? Parang matagal kong pinag-isipan if this is something that I should raise. But again, sa tingin ko, magandang pag-usapan kasi baka naman merong magandang paliwanag. Kasi sa akin, maraming paliwanag yan eh. Yung dalawa kong naisip, of course, is yung pinaka-bad faith interpretation is, ine-engineer ba yan? Diba? Parang presyo sa Shoemart, diba? Yung 79.95, hindi mo paabutin ng 80 pesos. Diba? Pwedeng ganon. Or pwede bang, do you have some leeway, quote-unquote, in carrying over cases? Halimbawa, the average, the total in 2 days is 10,000. O down payment muna tayo, 7,999 ngayon. Or ipagpabukas na lang natin yung iba. Pero alam nyo na, I mean, so maraming interpretation na pumasok sa aking kaisipan. So siguro po, I guess you'll have to take my word that I really saw the text 24 hours before. And having said that, would you have an explanation po for that? I'd like to ask the DOH.
Yusek Mirna. Oh, Yusek Rosette. Kindly answer.
Thank you, Madam Chair, and good evening again to Congresswoman Kimbo. First, the Department of Health has always been transparent with our numbers. We have this major platform that we use, the CBRS with the COVID Kaya, where it is only accessible by the different implementing units. And we never did averaging. Whatever numbers would come out, that is what we have reported since day one. Actually, there was this time that even the Office of the President called on us and they were asking if we were doing this because numbers were fluctuating during that time that our reports had not been managed yet or hindi pa siya ganun ka maayos. So we do not do that. We want to show the actual numbers per day. Now, as to what you have said, Congresswoman Stella, meron ho talagang nag-leak nung isang araw, and we're trying to identify the source coming from our team, from our COVID surveillance and quick action unit. So we have implemented measures already starting from that day. We have discussed this with our team, and we have warned every one of them about these leakages that has happened for these past days. And we know that sagrado po ang mga numero natin, and we do not want this initial information being shared already while we have not reported officially, kasi po nababago pa ho yan, no? Kasi nakakakuha kami ng alas 12 po ng tanghali, alimbawa ngayon, hanggang bukas po ng alas 4 ang pagkokolekta at paglilinis namin ng datos. Kung nakuha nyo po yan halimbawa ng gabi, ngayong gabi, maaring bukas iba pa ho yung numero natin. So these are the things that we do, but we have implemented measures where we have limited the access to data of our team. We only have our data managers handling the data now. Hindi na po namin sinishare dun sa the rest of the team. And also, the top line numbers that we have every day, binibigay ho kasi yan kay Secretary Duque at saka sa iba po hong EXECO members for anticipatory actions. Pero ngayon, ang meron na lang pong access sa top line numbers would be me and the Secretary, and of course, our Director of Epidemiology Bureau. So we...
Yusek,
Yes, ma'am.
Yusek, if this thing happened, if I saw the text hours before, on the same day, considered leak yon. But I'm telling you, I saw the text 24 hours before it was reported. In fact, I saw it even before the report for that day, for the day before, was released. So in other words, kung yung 7999 was for March 29, halimbawa, nakita ko siya ng March 28, even before the report for March 28 was released. So, hindi siya leak. Diba? So, yan ang sa akin nakakabahala. So, anong oras po ba ang cut-off every day? So, halimbawa, what time, let's work back. Sa protocol ninyo, what time do you report?
We have this process where alas 12 po ng tanghali ang umpisa namin, pero hanggang alas 4 kinabukasan. Pero as early as 7 p.m. the previous
Let's
day...
let's start with what time do you report to the public? 6 p.m.,
It's
4 p.m.?
4 o'clock in the afternoon.
Okay. So, and then, so right before that, what's the penultimate step? Meaning, what's the clearance? You report to the secretary? What time would that be?
It would be shared with me around 2 o'clock, 1 o'clock in the afternoon for my clearance.
1 o'clock in the afternoon. Okay, so what's the cut-off? Ibig sabihin, ano yung number of cases na i-consider for that day? What time is the cut-off? Kasi di ba all the labs report to you, right? So, surely there's a cut-off. Ibig sabihin, pag beyond that cut-off, i-consider na yan for the following day, di ba?
So, ma'am,
So, anong oras po yun?
Yes, ma'am, the process would be we extract at 1 p.m. and then we clean the data from 1 to 7 p.m. 7 p.m. may top line numbers na po kami. Yan po, na i-share na, lalo na kung merong kailangang i-flag kay Secretary at saka sa akin. And then the next day, inaayos na po nila yan, continuous deduplication, validation. Pagdating po ng alauna ng hapon, sinishare na po sa akin for final clearance and vetting. And then alas 4 po nilalabas po namin.
So the entire cycle is how many hours?
4.
That would be less than 24 hours.
From the time it comes in,
Yes, ma'am.
1
1 p.m.
p.m. of the same day?
No, it's 1 p.m.
And then-
from the previous day.
1 p.m. from the previous day.
Yes.
And then there's like about 24 hours of processing,
Yes,
and
ma'am.
then it gets reported 3
4
hours later.
Yes, ma'am.
So what you're saying, kung meron mang breach, which I saw it 24 hours before, ibig sabihin, anong paliwanag doon?
Maaari po, ma'am, that when we had our sharing of our top line numbers, ito po, lumabas po yan. Because it's not always din naman na yung top line ay mababago pa. Medyo wala na ho kami nakita na validate na ng maayos. So yung top line would be the same as what we will release by 4 p.m. So yun po, meron lang ho talagang nagkaroon ng leak and we were able to discuss with the team. Nobody wanted to say, of course, hindi naman po aamin, pero we tried to tighten the security among our staff already na yun na lang pong data managers ang hahawak at kami na lang po ang nakaka-receive.
And what is our assurance that there is data integrity?
Well, meron ho tayong validation system na ginagawa for this data integrity. So, yun naman po assured tayo no that it is being validated, there is deduplication, there is also further verification with the implementing units.
Right.
Yeah. Are there other questions, Kong Stella? No more?
For now, Madam Chair, none. Sana na lang po, kahit hindi nyo kami masyadong nakikita kadalas, we assure you po na nakabantay po kami. So, yan, lalo na po si Rep. Sharon.
Chairman,
Yes,
say kay Yusek Rosette, siya yung pinaka-idol ko sa DOH. I think she's one of the best executives in the DOH.
Lahat yata tayo, idol natin si Yusek Rosette. Very, pwede nang thank you, Yusek.
Ikaw na iwan.
Are there other questions from other members? Yes, Kong Gaite.
Manifestation na lang. I was reading the final report entitled The Impact of the COVID-19 Crisis on Households for the National Capital Region of the Philippines, dated December 10, 2020, by the Economic Policy Research Institute, UNICEF, UNDP. They did a survey of 3,600 households. And I was just concerned about the I think at the onset, what were the main questions were, what were the main reasons for the upsurge in COVID-19? And one of them was the compliance in mask wearing. Based on the survey, accordingly, all of the Filipinos interviewed were compliant. But as counter check, what they did was they interviewed also the neighbors. And 3 out of 15 or 1 out of 5 reported that their neighbors were not compliant or violated. So that's about 20%. And which did not comply, okay? But 80% complied, which is similar to the SWS survey of September 2020. Na ang sabi rin, 80%, 1 out of 5 complied. Which is why doon sa binanggit na mga rason, yung compliance ang naging reason kung bakit may upsurge. Anyway, sana makita ito kasi may at kahit paano yung survey will serve as a as a yardstick. Oh, literally. Pun intended. On whether that was the real reason or not, because I would rather believe yung problem pa rin ng testing. Kasi unlike in other offices, and I would like to verify this, apparently only us in Congress does the weekly testing. And I checked with other, well, of course, other than probably hospitals, no? Pero yung ibang government offices, walang ginagawang similar. Even the Senate, by the way, I checked with the union, the Senate does not have a regular weekly testing, even for those employees who have to report physically. So ito nga yung lumabas sa findings na sa Quezon City, where most of the government offices are located. Tayo sa Congress ang pinakamataas with 67, I think. The only reason I believe is because we do testing, which is the concept of if you're going back to work, at least get tested once a week. Secondly, I was listening to the report of Secretary Galvez, and 2 things struck me. First, well, among other things, he said vaccine security, and it should be high time that we make our own, and we do support that. We have always believed that one of the requirements for a healthy health system is a strong system where we create our own vaccines. Our ITM, I believe, has the capacity, but only on a very small scale level. I think for tubercular in other vaccines. And I think we do believe that's an important component. And secondly, he mentioned renationalization and integration of the PhilHealth system. Kami rin ay sumaayon dito because when this was devolved, it became fractured or nagkaroon ng kanya-kanya. Kaya kahit ngayon ay problematic ang ating mga LGUs in delivering the basic service as health. So yun lang yung gusto kong register na sana ma-consider ito in the development of our health system because this pandemic will definitely not be the last. Salamat po.
Thank you very much, Congw. At this point, I'll now turn over the chair to our hardworking and beautiful chairperson, Representative Angelina Tan. Thank you.
Vice Chair, Representative Sandra Irigel. Maraming salamat po. So before we adjourn, I would like to thank our members. 9 na oras po kayo na sumama dito sa hearing na ito. Basically, we were able to discuss the whole components of COVID response from
Madam Chair.
to treatment up to the discussion of the vaccination program, and the most controversial one, which needs action immediately, is the issue on ivermectin. So maraming salamat po sa lahat ng ating mga kasama. Ganun din sa ating mga resource persons sa kanilang pagtugon. Alam ko na ito ay panahon na para magpahinga, no? But thank you so much for your time.
Madam Chair.
Yes, Kong Tof.
Yeah, sorry. I manifested that I wanted to make a manifestation.
Okay.
Very, very quickly. Yeah, so I just wanted to enjoin the DOH to really look into using behavioral science as an approach to designing your public policy. Particularly on the issue of the vaccine and, getting more of our constituents and more of our mga kababayan to get themselves inoculated. It's really about ascertaining, how our constituents behave and how to get them to follow. And as a policy of making full use of our human resources, particularly our creative industry sector. So, Madam Chair, I'd just like to enjoin the DOH to look into these two sectors from our creative industries for collaboration as you design this communication strategy for inoculation and the vaccine. One is advertising. I think they would be very, very valuable allies as you come up with your taglines for the vaccine, as well as the visuals that you're going to be cascading to the public. And number two, apart from advertising, I would like the DOH to look into communication design. So ito basically yung mga graphic designers and graphic artists natin in the country. And they're actually organized. They're called Communication Design Association of the Philippines. And these two sectors, advertising and communication design, would be valuable allies to the DOH as you encourage more of our countrymen to get themselves vaccinated. And just by working with these two sectors, by extension, you're also going to be working with the film sector, the music sector, and even visual arts. So please, Yusek Vergere, I echo yung sinabi ni Mentor Sharon Garin na isa kayo sa mga iniidolo ko sa DOH. And I kid you not, I'm not making you baller or anything since the start of this pandemic. So please kindly look into these two sectors. And finally, there are two government agencies that I hope DOH can look into collaborating with for your communications. One is the Design Center of the Philippines, and two is CITEM. So they're both attached to the DTI, but they are largely untapped government resources who you can collaborate with because they have good networks in the private sector in designing the communication strategy for the DOH. Because even if you have all these vaccines available, and as we've heard in all these other LGUs na the vaccines are there, but there are no takers. So nasasayang lang. And then ang nangyayari, kung sino-sino lang sa tabi ang huhugutin at i-encourage para magpa-vaccine. So like I said, the experience of a 7% vaccine confidence in my district is probably not unique to my district. Maybe it's the same for many others that are outside of NCR plus. And so I think that's something that we really need to work on, inspiring confidence in the vaccine. And DOH kindly use the most valuable assets that we have, which is our creative constituents, our creative Filipino people. Please enjoin their support so that you can also accomplish your objectives efficiently and effectively. Yun lang po, Madam Chair. Thank you.
Okay, thank you, Kong Tov. DOH, please take note on the recommendation of Kong Tov de Venecia. I think our
Pwede
guest
po mag-manifest? Pwede po
PMA,
mag-manifest bago matapos
yes,
yung...
we'll recognize you, Dr. Benny Atienza,
Yes po.
President of Philippine Medical Association. Yes,
Ako po ay nag-iintay ng ilang oras para lang maparating po ang nakikita namin doon sa ano. Kasi nakipag-usap po ako doon sa... Kasi the Philippine Medical Association is in full support po of the DOH kasi ito po yung project ko, malapit sa akin puso yung vaccination kasi pediatrician po ako. Mga in-inject ko ngayon mga doktor na. And one of the problem po na kinausap ko po yung the AMHOP. AMHOP is the Association of Municipal Health Officers. And what is the problem po ngayon? Kasi susunod na po yung seniors. Ang hesitancy po mataas po sa seniors according to the AMHOP. And ano po yung nakikita nila? Kasi ang nakikita nila yung hindi masyado, yung mga doktor dapat kasi ina-explain sa kanila na kahit may hypertension sila, may asthma, pwede magpabakuna. Ang nakita po namin doon sa rollout sa mga ospital, bakit dumami yung nagpapabakuna ng nurse at saka itong mga health workers? Kasi kami mga doktor mismo ang nag-i-inject sa kanila. Nakikita nila yung concern namin, binabantayan namin sila. And may ano po sana, ang gawin na po natin, makipag-collaborate po ang Philippine Medical Association. Meron kaming 119 component societies all over the Philippines. And we promise na tutulungan namin ang mga health centers kasi isang municipal health officer lang po nandoon, hindi kakayanin po. Ang kailangan po natin na i-screen yung mga nakikita nila na may doktor doon sa health center na hindi lang, yun ang inihingi ng AMHOP na hindi lang sila, kailangan nila ng mga eksperto na nandiyan yung mga doktor magbabantay sa kanila and during the screening and monitoring. Yun po ang hinihiling nila kasi ang problem daw po na ibang pag nag-roll out sila sa health centers, malalayo yung health centers doon sa mga ospital. Ay kung isa lang yung ambulansya nila, na tapos doon sa ibang area kulang, tapos yung pupuntahan nilang, yun po ang dapat paghandaan natin kung merong magkaroon ng adverse effect. Siguro po pag nakita nila na maganda yung rollout natin doon sa seniors, magsusunod-sunod na po yan. Kasi yung ginawa po namin, yung rollout ng DOH sa mga doktor, dati ang gusto magpabakuna 75% lang. After ng rollout, makapag-lecture sa mga doktor, ilan yun? Naging 94%. Then we are planning, the Philippine Medical Association is coordinating with the 44 with the PRC, yung pong natin mga professionals kasi dapat ang anuhin natin yung mga professionals kasi yan ang magle-lecture doon sa kanilang subordinates na i-roll out din namin yung mga lectures sa ating mga professionals, hindi lang sa mga doktor, sa mga businessman, sa mga sa mga teachers, lahat po. Yun ang kailangan po natin. At saka kailangan po natin yung more on information campaign, lalo doon sa mga seniors. Kasi dito po sa Batangas, may isa po akong alam na isang barangay, ayaw nilang magpabakuna.
Doc Benny, I think PMA is in close coordination naman with the Department of Health, no?
Opo.
All your recommendations, kindly write to the DOH. And then we still have naman Yusek Mirna. Yusek Mirna, please take note on the recommendation of PMA. Actually, sa region namin, Region 4A, I was able to discuss that to our director, that we partners with private health facilities. Kasi after ng vaccination of all the health facilities, especially hospitals, parang tapos na doon, no? Yung participation nila to expedite our rolling out ng vaccination, covering kung simultaneously i-cover na natin up to A3 or A4 in the coming months. I think hindi tama po yung observation ni Doc Benny, hindi kaya po ng rural health unit. Another factor that we need to consider is assistance on transportation, no? At least in my district, I promised doon sa DOH, those who are living in far-flung areas, no, barangays, will provide transportation support doon sa ating mga scheduled priorities, no? Members of the priorities na scheduled for vaccination. So maraming problems that we encounter in the ground that DOH should address pa regarding this vaccination program. Okay? Thank you so much po, Doc Benny. Thank you for your time po and participation po. Again, in behalf of our Speaker Lord Alan Velasco, maraming salamat po sa inyo pong participation on today's meeting. Rest assured po that the House of Representatives will work hand in hand with the executive in order to assure, no, na yung mga gaps currently that we encountered in this COVID response will be addressed in terms of legislation. But again, hiling po namin sa executive, no, yung observation ng iba na marami pa pong kulang at pwede pa pong gawin. There's so much room for improvement on different aspects, from testing, contact tracing, to implementation of vaccination programs and treatments, no? Now, very critical po yung, like kanina sa presentation, yung mga hospitals natin, specialty hospitals and referral centers. I hope that we were able to prepare, no? Dahil isang taon na parang hindi dapat tayo namumroblema sa supply ng medicines, and the needs on beds, dapat nabigyan tayo ng enough time for a year to prepare kung sakaling magkakaroon again ng surge or mas dumami pa. So I hope na mabilis nating ma-address yung pangangailangan ng ating mga kababayan. So maraming salamat po sa inyong lahat. Can I hear the favorite motion? Maraming salamat po. 9 hours.
No to adjourn.
I move to adjourn, Madam Speaker, Madam Chair.
There's some.
Madam Chair.
Okay, thank you. There's a motion to adjourn. Julie seconded. I'm sure walang mag-o-object na po dito, no?
I object.
Thank you, Chairman.
Thank you.
Congrats.
This meeting is now adjourned. Thank you so much
you.
po.
Thanks, Madam Chair.
Bye, everyone.
Congrats, Chair. Thank you.
Salamat.
Thank you. God bless everyone.